Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Delta Ministry of Health intensifies contact tracing for coronavirus infections following confirmation of 2 top government officials in the state. 13 lawmakers test positive in Imo State as the state assembly remains shut. And South Africa to begin human vaccine trial of COVID-19 tomorrow. Now, as at the close of June the 15th, 2020, Nigeria recorded 424 COVID-19 deaths. A week later today, the death toll stands at 525. This shows that in the space of about 1 week, over 100 persons have died as a result of the virus across the country. Figures from the NCDC puts the number of coronavirus cases at 20,919, with a total of 7,109 COVID-19 patients recovering from the disease. 675 new cases were announced by the Nigeria Center for Disease Control, the latest infections in 21 states last night. Let's take a look at the regional breakdown, and you see Lagos State in the southwest on top with 8,864 cases, followed by the FCT leading in the north central with 1,583 cases. And Kano in the northwest has the highest figures at 1,190 cases. These are also the top 3 states with the highest COVID-19 infections in the country. Oyo State and Rivers State follow in 4th and 5th place in the top 5 states. Now, River State leads in the south-south region with 930 cases. Borno still tops in the northeast with 476 cases, and Ebonyi in the southeast with 264 cases. Now, the Ministry of Health is still on the trail of those who may have had contact with the top government officials in Delta State who have tested positive to the coronavirus. The 2 officials are Mr. Chiedu Ebe, Secretary to the State Government, and the Commissioner for Information, Mr. Charles Anyago. Already, some of their staff are reported to have tested positive and are currently being treated. As at today, Delta State, according to the NCDC, has a total 532 confirmed cases. Of this number, 382 are active, while 130 patients have been discharged and 20 deaths have been recorded. The Chief Medical Director of the Federal Medical Center, FMC Asaba, Dr. Victor Osiatuma, joins us on the program right now via Skype. We'd like to welcome you to the program.
Thank you. Good evening.
Let's begin with, since the index case, and this is index case recorded in Delta, what's your observation of the COVID-19 response so far?
Well, since the index case that was identified a little over 6 weeks ago, the cases have continued to increase. The response has been fantastic, but maybe because of the behavior of our people, the number has been on the increase. And so we've been battling to ensure that we care for all those who have been infected.
When you look at the rising cases, are you alarmed by it? And when you talk about the behavior of the people, you're saying they're not taking responsibility, our government's efforts towards sensitization, anything to go by?
The sensitization has been high. It's been adequate, but still a lot of people don't believe COVID-19 is real. And so you see the way they behave in the banks, you see the way they behave at the bus stations, the way they behave at the markets. It obviously shows that they are not aware that they are in danger. And that's why the number is rising. If we can keep to the simple instructions that have been laid down, the protocols that have been laid down of simple social distancing, washing of our hands, ensuring we wear our face masks and all that, I think we can break the cycle. But right now, a lot of people are not complying, and that's part of the problem.
Tell us a bit more about the role the FMC is playing in the COVID-19 fight. We understand you're managing some of the cases in Delta State.
We have one of the 4 treatment centers in Delta State, and we have quite a number of patients. The treatment center is full as I speak. We have discharged well over 25 of the patients, but we are full right now. And in addition to that, we still have the main hospital to run. And quite a number of these patients have been picked up in the main hospital. They present at the emergencies, they present at the general outpatient clinics. And so the staff are also exposed. Even those that are not wearing PPEs, they are exposed as well. So the function is dual, running the isolation center as well as picking up the patients as they present at the emergencies.
So in terms of that effort, are some of your healthcare workers infected? What other obstacles do you face in managing the cases?
Well, some of the obstacles we're facing is that, one, our manpower is going down. As I speak today, over 20 of our staff have been infected. We have treated quite a number of them, at least 15 of them or so have been treated successfully. They've been discharged, they've gone home. But during those times that they are being treated, they are not available to work. And immediately after discharge, they cannot return to work. So they need to get some time off to get treated. That's one. Secondly, with the coming of the isolation center, you see you have to deploy some staff. Not less than 50 of our staff have been deployed to the isolation center. Some are being used for contact tracing, some are being used for screening at the gates and all that. So quite a number of staff have been pulled out from the general pool you need to render service. So right now we are getting short of manpower, and so it would be nice if we can get some additional hands, maybe as volunteers or new staff to join in the fight, because as they get infected, as the days go by, the number is depleting. That is one. Secondly, the challenge of finance is there. Finance because even though the federal government is supporting us with consumables, the state is supporting us with a lot of consumables, PPEs and all that, but still you find that taking care of these patients requires a lot. You have to feed them, you have to manage particularly the comorbidities that they present with. Most times you are battling with the morbidities and not even the COVID itself. Some patients come in with renal failure, some come in with chronic anemias, some come in with cancer and all of that. And as you're managing the COVID, you have to manage these morbidities. If not, that's what they're going to succumb to. So it's a challenge having to provide these expensive drugs for them that are not part of the routine drugs we use for the treatment of COVID. So that, of course, is also contributing in depleting the internal generated revenue of the hospital.
All right. We hope that government can rise up to the challenges and also private individuals, private sector. We'd like to thank you. Wish you all the best. The Chief Medical Director of the Federal Medical Center, FMC Asaba, Dr. Victor Osayatuma. Thank you for joining us.
Thank you, and God bless.
Now, the National Directorate of Employment has set aside 15 million naira to boost small businesses in Bauchi State as part of measures aimed at mitigating the economic impact of the coronavirus pandemic. Our correspondent Hajar Ali brings us up to date on that situation.
The women you see here are owners of small businesses. I spoke to one of them who sells pap. She makes around 200 naira profit a day. The Ministry of Trade, Industry and Investment has said that more than 80% of the jobs in Nigeria are owned by micro, small and medium-scale enterprises. Analysts have been speaking about the economic impact of the coronavirus, and based on their analysis, they say that middle and low-income earners are mostly affected by the pandemic. These women here are here to receive a package, a micro package actually meant to enhance their businesses. This is courtesy of the National Directorate of Employment. I'm here with the state coordinator, Alhaji Lawali Yahaya. He's here to speak about it. Alhaji Yahaya, what is the scheme designed to achieve?
The scheme is an initiative of the Director General NDE, Dr. Nasir Muhammad Ladan Argungu. The DG realized that mostly women are hit by this pandemic, because men are at home, they don't go to work. Therefore, anytime a woman wants to prepare soup for the family, she will come and ask the husband to give her 10, 15 naira to buy salt and maggi. So therefore, he's eating into her own capital. With this thing, DG realized that by the time we enhance their capital base, they will go bounce back to the market at full capacity to continue what they have been doing. In Bauchi, the DG has targeted about 1,500 women. So today, because of the protocol of NCDC, we are starting with only 200 per cycle.
Since the outbreak of the coronavirus pandemic, different palliative measures have been introduced. It is hoped that these palliatives will go a long way to cushion the effect of the pandemic on the economy. From Bauchi, Hajara Aliyu for COVID-19 updates.
The Kaduna state government is re-strategizing on its COVID-19 efforts following increasing number of cases and alarming levels of geographical spread. The State Commissioner for Health, Dr. Amina Baloni, speaks on the integrated and holistic response to minimize the potential impact on healthcare facilities. According to her, putting isolation centers in all the general hospitals to serve the coronavirus case management and also other infectious diseases that may arise, and a comprehensive package of precautionary measures, amongst others, will help prevent a further spread.
We're developing the next 90-day plan, which looks at returning the focus back into our health sector. As you're aware, most of the resources were directed at looking at COVID for the first part of the pandemic. We realized that this cannot be sustained, and so we're looking at all our health system, including the primary health system, the secondary facilities, and the tertiary facilities, and looking at an integrated response where health workers will respond to the normal health challenges that we have, as well as integrate COVID response into it. For the medium term, we're looking at how we can strengthen those structures. So, for example, all our general hospitals, we're looking at putting isolation centers, which will serve COVID, as well as other infectious diseases should they arise.
Enforcing adherence to safety guidelines among internally displaced persons in Maiduguri is proving to be a huge task. The IDPs are more concerned about food and shelter as the rain set in. The state government COVID-19 response committee recently said the high number of positive cases recorded are incoming travelers intercepted at the city gate. Our correspondent Blessing Tuna tells us more.
This is the Muna Al-Badawi IDP camp, where over 52,000 people displaced from different parts of Borno State have found temporary shelter. It is the same camp that was gutted by fire a few weeks back, and the affected population are still trying to get back on their feet. Now, typically in a camp like this, the primary objective is livelihood, talking about putting food on the table. Shelter comes next before any other consideration.
They give us food, but it's never enough. Sometimes they don't give us anything until after 2 months, and in quantities that are not enough. That's why we go to farm, because if we don't, we'll die of hunger.
What we want is food and clothes, and for them to hasten in fixing our shelters. That's all we want them to do right now.
The coronavirus is just a passing phase. This is also why the Borno state government is doing everything to ensure that the disease is not imported into the state, because it's easier to prevent than to contain the community spread. From the Muna Al-Badawi IDP camp, I am Blessing Tono Aso for COVID-19 updates.
We'll take a look at the global response to COVID-19 when we return. Welcome back. 13 more lawmakers in the Imo State House of Assembly have tested positive for COVID-19, bringing the total number of the lawmakers who are COVID-19 positive to 14. The chairman of the state's task force on COVID-19, had announced the first positive case in the State Assembly, saying that samples of the other 26 legislators and their aides had been taken for testing. According to the task force, the lawmakers have gone into self-isolation with their families. The State Assembly complex has remained shut down since the first lawmaker was diagnosed with the virus. Over in Enugu State, 49 health workers are said to be among the 144 persons with confirmed COVID-19 cases in the state. 110 of those cases are active, 29 discharged, and 5 deaths have been recorded. The government says the health workers have continued to do their best in the prevailing circumstances to deliver on their mandates. According to the Commissioner for Health in the state, he has called on the residents not to suffer in silence, as this is not a time to avoid visits to hospitals when medical attention is needed. He has also stated the state government's resolve to continue to identify cases by testing, contact tracing, as well as decontaminating the homes, workplaces, or hospitals where identified cases and their contacts have been. Dr. Abiodun Paul is a medical laboratory scientist, also a public health expert with experience in West and East Africa. He was involved in managing the outbreak of meningitis in 2017. He joins us now from Abuja studios. Glad you could join us. Welcome to the program.
Thank you for having me. It's a pleasure to be here once again. Thank you.
Dr. Paul, I'd like to begin with your experience during the meningitis outbreak. What challenges existed at that time?
Yeah, we have a lot of challenges during 2017 meningitis outbreak. That was the largest outbreak Nigeria has ever reported in terms of meningitis. And of course, it was so much that it was spread from northwest zone of the country down to north central. But of course, when we see that, having identified the index case, we were able to know that we need to move into action by developing a micro plan with our team. The basic challenges that we have in those times was that there were a lot of treatment plan, a lot of treatment protocols existing. And of course, in terms of drugs that are available at different health centers where people are using to manage some of this COVID-19 of standard, they were not really of quality standard. So that posed a lot of challenges for us. And of course, it was a little bit difficult to compare that with what we have with COVID-19, though a lot of similarity exists. But of course, we were able to manage that through a robust system. Then I was the medical team leader for Medicines Sans Frontières then, and worked closely with the CDC, WHO, and UNICEF then to come up, using different EOC meetings to plan how to really attack that. So the challenges that we actually have those time, number one, has to do with the quality of the drugs available, and of course we talk about contact tracing was purely funded by the donor. And of course, we have the support of the government sitting on the driver's seat. But in terms of funding, the funding was actually by donor fund, donor driven. So, and that was actually what happened during those periods. So
Dr. Paul,
the challenges ranges from the cases were scattered, they were not nucleated, they are not easily seen. And those are the things that we do, yeah.
Compared to what we're facing now, and this is the COVID-19 pandemic, what are we learning as to how to reduce our numbers and stop any wave or second wave of the virus?
Yeah, one of the things that we need to do is to know the quality of, the medication that is being given to some of these people, especially people that have comorbidity, because these are the people that accounted for over 50% of death that we have. And because this was one of the major challenges that we have then, and this was, we were able to address that by ensuring that the quality of medicine given to these people were actually of high quality. And number two, the contact tracing need to be properly done. Then we have the air promoters team, which are people that have a strong competency, people that have been well trained on how to do contact tracing, case management. Of course, a lot of our treatment centers then in northwest zone of the country. I think these are the things that we can actually bring in to look at how can we sincerely ensure that we have a quality contact tracing, a quality case management, and all the treatment protocols are regulated. We follow the same standard, and there is a quality information, because I see a lot of communication gap existing. People will tell you they don't believe that COVID-19 is existing. Somebody can tell you how many figures, those figures are political, and a lot of things are. So people actually have to also see. And one of the things that helped us then was that we're able to work with the community leaders, we work with the government, we engage the religious leader. We have a lot of messages interpreted in different ways by which the target audience could also be easily hit. So, and that actually produced the magic that we did in 2017. I think this also is still lacking. People want to see, when you say you have a COVID-19 patient dying, they want to see that. During our period, people have seen people dying of meningitis, see children or older age, adults, people coming down with. So these are the things that we need to really come together to see, to actually address in terms of a lesson learned that could be applicable here in a sincere manner.
All right, we'd like to appreciate your time. Thank you so much, Dr. Abiodun Paul, medical laboratory scientist, public health expert. Thank you for joining us on the program. South Africa is set to begin human trials for a COVID-19 vaccine developed by Oxford University. Some 2,000 people in the country will be involved in what is widely considered to be one of the earliest and most advanced trials for a vaccine to tackle the pandemic. Similar tests are already underway in the UK, but the infection rate there is slowing, hence the move not just to South Africa, but to Brazil too, where 5,000 people will be involved in the vaccine trial.
A lockdown is being reimposed in the German region of Gütersloh after a coronavirus outbreak linked to a meatpacking plant. Social distancing measures will return to the level of March. People in the district can only meet people outside who belong to their own household. Indoor group activities will be banned. Concerts, cinemas, museums, galleries will be closed. Sport in closed rooms will be banned. Gyms, swimming pools, and saunas will be closed. Picnics and barbecue will be banned. Bars and cafes will be closed. Restaurants can only serve meals to go. As the number of people to die in connection with COVID-19 in the U.S. passes 120,000, the state of Florida alone has now reported more than 100,000 confirmed infections. Nearly 3,000 new cases were diagnosed, according to local health officials. Newborn triplets in Mexico have tested positive for coronavirus in an unprecedented case, according to local health authorities. Medical experts are investigating whether the disease could have been passed on through the mother's placenta during pregnancy. 2 of the babies, one boy and one girl, are in stable condition in a hospital in San Luis Potosi State. A supercomputer in Japan is being deployed in the fight against coronavirus pandemic. The large machine, named Fugaku, is being used to simulate how droplets will spread in office spaces with partitions installed or in packed trains with the windows open.
Wear a mask on your face, not your chin, as it has no value under your chin. You can find the latest guide on the NCDC website on keeping safe, as the centre continues to work closely with states, training health workers to manage COVID-19 patients to recovery. It also has the latest national strategy to scale up testing and other public health advisory. The World Health Organization has the latest update on the global response to the pandemic at national subnational levels. It includes practical guidance for strategic action. Of course, our website, channelstv.com, has more updates on the pandemic news, also in Nigeria and across the world, and other stories. That is channelstv.com. Thank you for watching. I'm Millicent Walker. Stay healthy, stay safe. We have another update at 9 p.m.